winter, in case you just wanted to peek out the window and kind of confirm that for yourself here in Florida. But we are in the middle of flu season too. And that season runs from October 1st through March 31st. And we find that every season for flu is a little different, although we do have the vaccine, and we're going to have Mike talk about that in a little bit. But that covers a variety of flu viruses or influenza viruses. That stays pretty consistent. But we see some peaks and valleys in the flu when we look at it from a nation perspective and pretty much global perspective too. And we'll go ahead and talk about flu, how to keep yourself healthy first. Then we'll talk a little bit about the vaccine, kind of dispelling some of those myths, because yes, there are some questions out there and some myths out there, and we'd like to make sure that everyone leaves here with all the information that you need to stay healthy and to help your friends and family stay healthy as well. So the two main areas that I want to focus on, I'm a nurse. I'm Karen Reynolds, if you haven't met me before, and I cover a lot of the flu influenza while we're here in the hospital. But also outside the hospital, two main areas of focus that we want to look at is taking care of you, the person, and you as either a family member, a caregiver, people that you come in contact with, and then the environment too that's out there. So there's a lot of things out there in the environment that help contribute to either your health and wellness or that can contribute to your illness. And then somewhere in between the mixture of you and the environment, there's these germs and bugs, and that one of those is influenza. And we're going to talk about that. I was at Disney this weekend, and the parking lot, I heard this kind of on the tram, the parking lot holds 50,000 cars. It's like one of the biggest parking lots in the nation, right, for recreation. And you think about how many people are in all those cars. Then you think about how many people are in all those parks. And I was in Magic Kingdom, and I thought of everything, because I thought I'm giving this lecture on Tuesday, and I thought, everything I'm touching, how many thousands of people have touched that before me? Handrails. So anyway, just kind of an interesting perspective when you start to really think about the environmental aspects of things as well. We're going to start to talk about the prevention. And really the Centers for Disease Control really guides us on a lot of our influenza initiatives, programs, what our nation really kind of the plan for influenza and keeping ourselves healthy and well, and guides us through that. So that website is very, very good to look at too, and we're going to send you home with some handouts as well. But those of you that are watching as well, go to the CDC influenza website and take a look, and there's a lot of information. They talk about really three things to do to urge you to follow actions to protect yourself. One of those is take time to get the vaccine. Again, we'll talk about that. Taking everyday preventative actions to stop the spread of germs. We'll talk about that. And then taking antiviral drugs, flu antiviral drugs, if your doctor prescribes them, and when those are needed as well. So those are the three main actions. Vaccinate, preventative measures, and then taking the medications if you do get the flu. So those three things. Let's talk a little bit about keeping yourself healthy, though, because remember that kind of domain of you. You are responsible for you, although we're sometimes responsible for other people as well. But think about you and keeping your forces strong and your immune system. And that really is looking at vaccinating, getting vaccinated to protect yourself. And to protect your own immune system, because realizing that vaccines don't cure diseases. Sometimes they can stop the spread of diseases in a context. Again, Mike will talk a little bit more detail about how vaccines work. But again, it is to boost your own immune system. But there's also things you can do to boost your own immune system. That's getting enough sleep. The recommended amount of sleep, somewhere between 6 to 8 hours. 7's pretty much the norm. Eating healthy. We just kind of had a conversation ahead of this about talking about what are the right foods to eat, how to eat healthy, how to stay healthy. A diet rich in fruits, vegetables, lean proteins, healthy fats, maintaining a healthy weight, managing stress. That's a big one. Managing stress is kind of interesting, and that's individual for a lot of different people, but there's a lot of research that supports that the increase in your stress level, the lower your immunities start to happen, and that things can start to enter in. Exercise, sleep, they're powerful immunity boosters. They talk about exercising 20 to 30 minutes a day. And again, there's a lot of research out there. Not everything's like strong research, so you got to kind of watch what you read. But there was one thing study that did talk about Tai Chi as boosting certain cells, so the immunity within certain cells by a percentage. So just kind of watch what you read. Make sure that there's enough data out there, because there'll be one study that says that something does something, but that's not always true. So you have to be careful. But that was one interesting one that I saw kind of a little bit more information on. So that's what you can do. Sleep, eat healthy, manage your stress, get vaccinated. What about the environment, which is huge out there, which is what we need to do to protect ourselves against others and other factors. So washing your hands, one of the biggest things that you can do to prevent the spread of any diseases and germs is the washing of your hands. Soap and water is the best, so from top to bottom, and they recommend you sing the song Happy Birthday twice. So, happy birthday to me, you can say me or whoever, but sing that twice. Always get your thumbs when you wash your hands, always get all the way up, and scrub. Scrub between your fingers, your thumbs. They found the thumb is the most least washed digit because you're always washing your fingers and the thumbs sit out there, so make sure you wash. And then if you can't get to a sink, they have the gels. I think you've seen those before too. I didn't bring a sample of one, but as long as they're at least 60% alcohol, they can be effective. Now, antibacterial soaps really aren't doing much good anymore. There has been a lot of research that supported antibacterial soaps really have no benefit over regular soap and water. So you see a lot of antibacterial soaps. Now, that's not to say in the event that you're not going for a procedure or such, but under the general public, antibacterial soaps, they found are just the same effectiveness as general soap and water. So another thing, I kind of started looking at what you use in your household. What about toothpaste tubes? When you share those with even the people that you love and care about. If that person that you love and care about is sick and you want to get sick, your toothbrush touches the end of the tube. Maybe have separate toothpaste tubes. Change out paper towels. Change out home items that you commonly use. Disinfect items, so kind of wipe them down. Wipe them with soap and water. Maybe wipe them with some of those gels as well that would be effective on your remotes, your TV remotes. That one's used kind of frequently. Doorknobs in your house, faucets, all that to kind of, in the event that you find that there's starting to be an increase in activity of germs and spreading and sickness, even within your own context of your own environment, you can do that. And then when you're out in public, be careful when you touch those things. You might want to have a paper towel in hand when you touch and turn off faucets and then throw that away. That's the last thing you do is throw away that paper towel. Think about ATMs, right? All these public places that you go and all these things you touch, because we're going to talk a little bit about the virus itself. They talk about, too, staying home when you're sick, at least 24 hours after the fever is gone. And the virus, the flu virus specifically, can survive on surfaces between 2 to 8 hours. So if I was in line at Disney at Splash Mountain and it was a 60-minute line and someone touched it and they had the flu and I was right behind them, I would be an hour behind them. So be careful. Be very careful. So what about other remedies for the flu? Are they effective? You know, you hear all these things. I'm telling you, it's a marketing business. I'm not going to talk about any specific products, but I'll talk about some categories of products. Vitamin C and zinc. Now, we know there's a product out there that says, take this right away. You're not going to get sick if you take this. And vitamin C doesn't prevent colds. Again, we looked at the research, looked at some studies. Extreme exercises and marathon runners, they did a small study. They took vitamin C ahead of colds and fevers, and it did curtail it. But that's people in a certain population and setting. But under the normal population, evidence shows that it may shorten the duration for those specific population, but vitamin C does not prevent colds. It does not prevent it. Zinc, limited evidence out there too. So we look at zinc. It reduces the length of colds, possibly small amount of evidence out there, but it can have serious side effects. So you have to be careful with utilizing zinc or taking zinc. The FDA warned in 2009, 130 people taking zinc, they lost their sense of smell. nose swab that they use. So there's some side effects. So nothing's benign, nothing, it doesn't take the cold away or the flu away. Antibiotics. Do you take antibiotics for the flu? No. Antibiotics are for bacteria. The flu is a virus. So you don't take antibiotics. Now, if you take antivirals for the flu, you may sometimes get a bacterial infection, and we're going to let the expert over here talk a little bit more about those medications together. Echinacea. Echinacea is a nice, pretty flower down there, and there is weak evidence, again, that does not cause you to not get the flu or curtail it. And chicken soup. I don't have chicken soup up there, but how many times do you hear chicken soup? Chicken soup is good. It's just good for the soul, right? There's a whole bunch of books out there about chicken soup being good for the soul. But there's weak evidence that it, cures you of a cold or the flu, but it is good to get you rehydrated, right? So it's a good thing to keep your nourishment and give you hydration, but it's really not anything that's going to prevent you from getting sick. Hot, right? It's comfort. Then you, it is, it's good for you. What's that? Oh, garlic. No evidence out there either. Garlic keeps people away from you. That would be while you're sick. So that would be one reason. But no, garlic, again, none of these are going to be anything that stops you from getting the flu. Hand washing, vaccination, keeping yourself healthy, preventative measures are the best. So if you get sick, how do you know if it's the flu or not? So influenza, also known as the flu, is a contagious respiratory disease. Upper respiratory, it's caused by a virus. We talked about that. And it can cause mild to severe illness, and at times can lead to death. I did just read a headline last week in the state of Indiana. 4 people have died from the flu since October. I don't know what other states are, but knowing that it can get severe enough. And that's why we need to take it serious when we hear that there is activity of the flu. And even if there isn't, that we prevent ourselves from getting the flu any season from October to the end of March. The CDC, the Centers for Disease Control, does have on their site as well. You can try, I put it on our blog, our Sarasota Memorial blog. There's a link that you can look at a map and week by week look at the activity state by state. The colors have changed, obviously, since October. It was an open country. Nobody had the flu. Now, as the weeks have gone by, we're well into, again, the middle of the flu season, second or third week of January, and now we see the colors changing in the states of the activity of flu. Certain states have widespread activity, one of those being California, I think Michigan, and we're starting to see some of that. Florida's somewhere where we don't see widespread activity, but we are seeing an increase. So again, if you get sick, how do you know it's the flu? It's different from a cold. It comes on suddenly. People who have the flu often feel some or all of these symptoms. Fever or feeling feverish with the chills, but not everybody gets the fever, and especially right away. Older adults tend to not have the fever right away. A cough, sore throat, tiredness, runny or stuffy nose, muscle or body aches, and headaches. Some people may have vomiting or diarrhea, though this is more common in children than adults. And again, I emphasize it's important to note that not everyone with the flu will have a fever, but you will feel sick. And you will feel sick suddenly. And if that's different, then that's something that you need to make sure you let your doctor know. So when do you go to the doctor? How do I know that I shouldn't just stay at home and get myself better with rest, right? Some chicken soup to make me, to stay hydrated, water. When you should see the doctor is if you have the symptoms of the flu and the symptoms are getting worse. They're not improving. And within 24 to 48 hours of onset, you feel yourself getting worse. Your fever's rising. And if you're on a high-risk category, which I'm going to talk about, the individuals that are at high risk to getting the flu that really, really need to see their doctors right away, because these are the individuals that need to get on the antiviral medication, because you do not want that duration of the flu to last longer or to get more severe. And then they also will help you with a plan of care. So if you have been diagnosed with the flu, you should recover in several days to less than 2 weeks. It shouldn't last longer than that. But people may be more susceptible to getting other diseases because you have a virus now that your body's fighting and it suppresses you. So hand washing during that time is really, really important because you can get an infection on top of an infection. So you need to be really careful. You know, some of those other infections that can happen with the flu is sinus and ear infections. Those may be complications. You could get a pneumonia. Now, these can be bacterial. Remember, the flu is a virus. These can be bacterial infections. So what are the emergency warning signs of flu sickness where immediate attention is needed as well? So during any time of the course of the illness, this is definitely when you need to seek emergency medical treatment. And I broke this down into children and adults. And in children, if there's fast breathing or trouble breathing, bluish skin color, and you may see that around their mouth, their fingertips, and that's a late sign. So if their trouble breathing is your first sign, and that's when you should go. You shouldn't wait until you see the blue color. Not drinking enough fluids, so they can't get fluids in because then they may need to have another method of getting fluids into them. Not waking up or not interacting, so all of a sudden they become really what we call lethargic or tired. You know, children, oh my gosh, again, I go back to Disney. Unlimited energy in these young kids on any ride or a line or anything. But all of a sudden, if they become really fatigued and tired, and that's not their norm, that's something to, and they have any other of the symptoms. Being irritable that they don't want to be held. And flu-like symptoms improve, but then return with a fever or worse cough because then they haven't really fought off that virus. And fever with a rash is big too. In adults, though, we do want to look at difficulty breathing and shortness of breath at any point during the illness, and that's a new symptom. Pain or pressure in the chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting, and then again, not being able to take those fluids in. And flu-like symptoms that improve but then return with fever or a worse cough to be taken very seriously. In addition to these signs, get medical help right away. If any infant who has these signs is unable to eat, trouble breathing, no tears when crying, and significantly fewer wet diapers than normal, because remember, infants can't tell you symptoms. You really have to watch and monitor any of these things as far as their breathing, inability to eat, and then the dehydration that can happen. I talked a little bit about who are those people then that should, when these symptoms have the onset of symptoms, should they go right away to the doctor to get the antiviral medication as well. And people with high risk for developing flu-related complications are these certain populations: children younger than 5, but especially children younger than 2, adults 65 years of age and older, pregnant women up to 2 weeks postpartum, post-delivery, residents of nursing homes and long-term care, American Indians and Alaskans, and people with certain medical conditions, which I'm going to talk about in a minute. So any of these individuals, immediately when they have those symptoms, need to go to the doctor right away. There's a test, and again, Mike will talk a little bit about that rapid screening test that helps identify whether you have the flu or not and to get on those antivirals right away. Medical conditions which bring higher risk of catching the flu: asthma, again, upper respiratory breathing, any neurological or neurodevelopmental conditions, so any disorders of the brain put people at increased risk, any chronic lung conditions that they may have puts them at increased risk of catching the flu. They're already susceptible. Heart disease, any blood disorders, any endocrine disorders, and diabetes is one of those as well that puts you at increased risk for catching the flu. Kidney disorders, liver disorders, any organ disorders is really what we're looking at right here. Any other chronic condition that you may have with any of your organs. Any inherited metabolic disorders, any other weakened disease immune, things that have weakened your immune system either chronically or suddenly as well. People younger than 19 years of age who are on aspirin therapy, and then people with extreme obesity or body mass index of greater than 40 or more. The flu is contagious. misnomer that it is contagious, and most healthy adults may be able to infect other people beginning 1 day after symptoms develop and up to 5 to 7 days after becoming sick. So when you feel sick, stay away from other people. Healthcare workers tend to always heed this advice and tend to come to work when they don't really feel as well. But during flu season, if you're not feeling well, stay home. Anybody, everybody. Children may pass the virus for longer than 7 days. Symptoms start 1 to 4 days after the virus enters the body. That means you will be able to pass the virus on to someone before you know you're even sick. Some people can be infected with the flu virus but have no symptoms. During this time, they still, again, can spread it to others. So again, stay away from sick people, and sick people stay away from other people. You do become a little bit isolated. Find somebody that can care for you, though, and give you your chicken soup and fluids, but stay away from other people. Don't go shopping. Don't go to Disney. Am I bad saying Disney? How the flu is spread. Person to person. So people with flu can spread it to others up to 6 feet away. I think you're about 6 feet away from me. So if I sneezed right now and it was in the droplets, you are within reach of my germs, of getting the flu. I didn't cover my mouth or anything. So they recommend people can spread the virus to others 6 feet away. They say the flu virus is spread mainly by droplets. When people cough, sneeze, or talk. I mean, you do sometimes have a little excretion of saliva that may come out when you speak. So be very careful if you're in close proximity. And those droplets can land in the mouths, noses of people who are nearby. Less often, though, you can get it from those objects where it's on the surface from 2 to 8 hours. So that's why those soaps or those gels can help a lot. And don't touch your mouth and nose a lot. And when you sneeze into your sleeve. I don't think I highlighted that on that one slide that talked about that, sneezing into your sleeve. If you do sneeze into a tissue, throw that tissue away right away and wash your hands immediately after. All right, I'm going to turn it over to Mike, who's going to talk about vaccinations.
Good morning, y'all. As Karen said, my name is Mike. I am a pharmacist in residency here at Sarasota Memorial, and I'm going to talk to you today about the flu vaccine, following up on Karen's excellent presentation on how to not get the flu. The vaccine is one of the most important ways to not get the flu. So, as she said, flu season runs, some say October, some say September to March, and the peak is from December to February. So we're currently in the peak. However, even if you're outside the peak and have not been vaccinated, you should still get vaccinated. 5 to 20% of Americans get the flu every year. And as you can see, hospitalizations have ranged from 140 to 210,000 people every year since 2010. And as Karen was saying, 4 people so far this year in Indiana. Well, annually we lose 3 to 49,000 people to the flu. So it is still a real, very active disease. Most people think of the flu as just, it's just the flu, it's no big deal. It still is a very big deal. And on average, hospitalization and medical costs of $10 billion in the US every year. So myth number 1, vaccines are no longer necessary. Does anyone think that's true? Hopefully no one in the room, hopefully no one on Facebook either. We've had some diseases disappear entirely. The only one that we've eradicated around the world is smallpox. Other than that, every disease that we vaccinate against is still real, is still a threat. And while we have some in the US that we don't see very often, they're just a plane ride away. Think of how many people we have in Florida who come from somewhere else and on a plane for 8 hours with people from all over the world, bringing diseases that you never hear of measles or mumps. However, they're still active in other places of the world. We want to make sure that you vaccinate for everything. We do see still polio, measles, tetanus, whooping cough, especially measles, whooping cough. We've actually seen outbreaks of those in many areas as people have stopped vaccinating their children, and we're seeing huge outbreaks of them. They are still real and they still happen. And if you get the flu vaccine, you are 60% less likely to need treatment for the flu. So a very inexpensive shot can save you a lot of money later on in the year. So as we see, why are vaccines so important? I don't have these numbers memorized, but as you can see, we went from smallpox, 29,000 per year to nothing, 21,000 whooping cough per year to nothing. Sorry, 200,000 whooping cough a year to 21,000. We go from tetanus, 580 cases of tetanus a year to nothing. You see huge drops in all of these things, but we're starting to see peaks in some of them. So what about flu specifically? The flu vaccine prevents 5 million people a year from getting the flu. So because we vaccinate as many people as we do, 5 million of them avoid getting the flu at all. 2.5 million people avoid having to see a doctor, and 71,000 avoid having to go to the hospital. So why do you need to get it every year? Because I know that when you were a child, you got measles, mumps, rubella shot, you got a series of those and you're done. You get the hepatitis shot and you're done. The flu vaccine has a couple of characteristics that make it different. First off, the strains that we vaccinate against change every year because we have different strains that come active every year and then just kind of disappear over time. I know you remember probably the H1N1 scare in 2009. That was a huge swine flu scare of 2009. That year, that was an active strain. This year, it's not so much, so we don't really necessarily vaccinate against it. In addition, your immune system loses response to the flu vaccine over time. So every year, you basically need a booster to remind your body what it looks like. And then myth number 2, vaccines cause autism. This is my least favorite myth. Everyone cites this study, this Wakefield study that was published in the UK. It had 12 children in it. They concluded from a study of 12 children that the author had picked ahead of time who he knew had autism and determined that the vaccination had caused it. He received compensation that he shouldn't have and did not disclose. Every journal in this was published has revoked it. He has lost his license. And yet, here we are, 20 years later, still dealing with it. Since 2003, the CDC has funded or developed 9 studies. Hundreds of thousands of children have been studied. No link whatsoever between vaccines and autism. And we still can't get rid of this myth. And as we said, no link between the flu, also no link between MMR or any other vaccination. So myth number 3, I get sick after getting the vaccine. Okay. You cannot get the flu from getting the flu vaccine. The flu vaccine is dead virus. It is not a live virus. It can't do anything to you. You might feel a little sick after you get the flu vaccine. You might have a sore arm. You might get a low-grade fever. That's a good thing. That means your body is mounting an immune response and developing the antibodies you need to fight the flu if you ever get it. But the joke that I have heard, and I had an MD who used to say this, the difference between the flu and not the flu. If you're laying in bed and you're real sick, you see a $100 bill on the floor. If you get out of bed and get it, you don't have the flu. If you stay in bed and stare at it, and you're like, I just can't do it, you have the flu. If you have the flu, you know it. If you don't have the flu, you know that too. And then, as it says, you may develop other symptoms from like a rhinovirus, which is a cold. But again, that's not the flu. Myth number 4, vaccines should not be administered to pregnant women. This is also not true. Obviously, you want to follow your OB's advice. But pregnant women during flu season should receive the flu vaccine. There are actually several vaccines that pregnant women receive, and they're all perfectly safe, following the OB's guidance. And pregnant women are more liable to get sick if they get the flu and more deeply sick if they get the flu. So they should absolutely be vaccinated. So who should get vaccinated this season? If you are over 6 months of age, you should probably get vaccinated for the flu. Almost everyone in the United States who is over 6 months should be vaccinated for the flu. If they're under 8, and they have not had the full shot, they get 2 a year. They'll get 1, and then the next one 28 days later. If they're over 8, they will just get the regular 1-shot deal. We also have high-risk groups that Karen mentioned that are especially at risk of getting the flu if they do not have the vaccine. So those are kids younger than 5, and as she said, especially younger than 2, people over 65, people with chronic diseases like COPD or asthma, people with endocrine issues, kidney or liver diseases, weakened immune systems from like chemo and other meds, absolutely should get the flu shot. But even if you don't have those, you should get the flu shot. So who should not be vaccinated? People under 6 months of age. And part of why it's so important for the rest of us to get vaccinated is to protect those babies who cannot get vaccinated. Like in the measles, mumps, and rubella outbreaks that we're seeing, it is the little kids who cannot be vaccinated that are getting the diseases because the older children are not getting their vaccines. So we have people who have severe life-threatening allergies to flu vaccine or components. If you have not gotten the vaccine previously because of an egg allergy, we now have formulations that do not have egg products. Just make your provider aware of that, and they should have them in stock. If you've had a serious adverse reaction in the past after getting a flu vaccine, usually means something like Guillain-Barré, which is an extremely rare neurological condition that happens after vaccination sometimes. And then if you have an immune-compromising condition, like a cancer, or if you're on chemo, or if you're on a chronic long-term immune suppression med, you should speak with your physician before you get the vaccination. So we have available flu vaccines that number probably 20 or 30. It's a hugely confusing list, but it's easy to figure out because they all work the same. The best one to get is the one that your provider has in stock. So wherever you go to get your vaccine, whichever one they have is the one that you should get. We have them trivalent, which means they have 3 strains of virus. The quadrivalent have 4 strains of virus. We have one that has an adjuvant that's supposed to make it work better. We have one that's cell culture derived. That's the one for the people with the egg allergies. And then we have the recombinant, which is made in bacteria, which is strange and weird, but stress us. And then we have the high-dose one that is recommended for people over 65. We have the intradermal, which is supposed to hurt a little bit less, but I have heard that it does not. And then we have the intranasal live vaccine, which is actually no longer recommended. The CDC says we're not doing that one this year because the risk outweighs the benefit. So, like I said, which vaccine should you get? The correct answer is pretty much whatever one you can. They're all essentially the same. Your physician or pharmacist can tell you which one's right for you, but like I said, they're basically identical. And as I said, the ACIP does recommend against using live vaccine this year. So where can you get the vaccine? I'm going to plug us a little bit. You can go to any one of our urgent care centers, walk right in and get it that day. You can also get it at neighborhood pharmacies, at your physician's office, at other walk-in clinics. Essentially anywhere that medical care is provided, you can get a flu vaccine. And then we have, as Karen mentioned, we have a lot of flu resources. So if you want to know about vaccinations, don't just Google. Go to the CDC, go to the ACIP, go to the Immunization Action Coalition, the American Academy of Pediatrics, good, reputable scientific sources. So, any questions for me? Or for Karen?
Every time you do come in the hospital, we do screen you to ask if you've received your vaccine during the time frame of mid-September to the end of March. In the event that you haven't received your vaccine, it will be offered while you're in the hospital as well. So it's another kind of safety net in order for patients to get vaccinated, or community members to get vaccinated. Our goal, though, is to have individuals vaccinated outside of the hospital and early enough in the season. It's not too late now if you haven't gotten your vaccine to still get your vaccine. We do recommend that as well.
And then I know Karen mentioned something about the rapid screening for the flu. If you feel like you're ill and you want to know whether it is the flu or not, the physicians have tests in offices, and some pharmacies, most walk-in clinics, can perform a test that takes about 5 minutes. They do a little swab of your nose, and 5 minutes later we know if it's the flu or not. And that can detect that before you're symptomatic. So if you have been around people with the flu and you just want a clear conscience or a clear peace of mind, you can go to a walk-in clinic and get that done, or like I said, some pharmacies. Right, and as you said, Mackenzie was mentioning that kids don't like being hit with a needle when they get the flu shot. They prefer the nasal spray. Um, we're not really sure whether or not. They just decided that this year, 2016-17, the risk of the nasal spray does not outweigh the benefit. The issue with the nasal spray is that it is a live virus. Most flu vaccines, you will not get sick because it's dead. The nasal spray is live. You can get the flu from the nasal vaccine. So this year they decided that the risk of getting the flu did not outweigh the benefit of not getting the flu from that because the shots work just as fine. And I know kids hate getting stuck, and I know people hate sticking the kids, but it is the best recommendation this year.
The flu vaccine covers 2A, the trivalent, or he said that the three, it covers 2A viruses and a B. If you do get the quadrivalent, which is 4, it's 2A and 2B viruses that it covers. Mike, why don't you tell them a little bit about herd immunity?
Herd immunity. Karen would like me to explain that to you. As I was saying earlier, we are seeing a lot of measles and mumps and diphtheria and whooping cough outbreaks in areas where people are not well vaccinated. And the issue is that, and every disease is different, once you get below a certain percentage of the population vaccinated, the disease can circulate. Every disease is different. I believe measles is around 90%. So if you're in an area where less than 90% of people are immunized against the measles can circulate. And it doesn't intend to attack adults or even teenagers or adolescents. It gets little kids who have not been vaccinated sick. So we rely on public getting vaccinated to protect everyone. Part of why we haven't seen those diseases in so long is that we've had such a huge campaign for vaccinations. Vaccinations is one of the greatest public health accomplishments of the last century. But now we have generations of people who haven't seen those diseases, and they don't understand how important it is to get those vaccinations.
Okay, I'm going to let the pharmacist talk about that as well.
For flu specifically, there are two common antiviral medications. One is an oral tablet, oral capsule, and one is an injection. We see the oral capsule more than anything else. It's called Tamiflu. I'm sure you may have heard of it. You can take it for treatment, in which case you take it twice a day for 5 days, and that's if you have active flu. Or you can take it for prophylaxis or prevention, where you take it once a day for 10 days, and that's if people in your house have the flu, you keep you from getting it. It shortens the duration of the flu, it shortens the duration of how bad you feel, and it shortens how long you're able to transmit it. It's pretty well tolerated. It's brand only right now. It's going generic fairly soon. Most insurances do cover it.
Viral, an antiviral, not an antibiotic. Okay, just to emphasize, yeah. Any other questions? Mackenzie? I do think this is an important topic. I think that it's something we need to pay attention to. And again, the CDC site, I'm going to say, is really the best wealth of information for both healthcare providers and for consumers. The general public as well. They have a lot of information, and it's very easy to kind of follow and it's accessible. We have 2 handouts for you, too, that we'll send you with. One, again, is the 3 actions to take to fight the flu, and then why get a flu vaccine as well. So we'll send you with those. cdc.gov, thank you. Thank you. So stay healthy, take care of yourself. Get your vaccine, wash your hands, stay away from sick people. Have fun, though, but wash your hands. Vaccinate. All right, thank you very much.